Okay, so for insulin administration, what I would do is first of all, I would go into my patient's room. First of all, before I go into my patient's room, I would verify my order, make sure I have the correct type of insulin, the right patient, and the right sliding scale. Then I would go into my patient's room. I would go and verify their identity, ask them their name and their date of birth, make sure that they're the right person, and I would compare it with their wristband. And then I would do a focused assessment, making sure that my glucose check that I did previously is correct. Because if it's not correct, it could have a false high or something else like that. So I would need to do a focused assessment to look for signs and symptoms of hypoglycemia or hyperglycemia. A couple of signs and symptoms of hyperglycemia: they're going to be hot, their skin is going to be dry, they may have some seizures, some vision changes, and they're going to be urinating a lot. That is a pretty late sign. But then if they're going to have hypoglycemia, their skin is going to be cool, it's going to be clammy, they're going to have vision changes again, and so I would just want to do a focus assessment just to make sure. Once I do that, I'm going to go and I'm going to get my insulin prepared. So with the sliding scale and checking the doctor's orders with the sliding scale and seeing if it's a scheduled thing, then I would want to choose my insulin correctly, and I would want to make sure that I have the right amount of insulin. So for demonstration purposes, I'm going to need to mix 2 units of insulin. I'm going to be mixing NPH insulin and regular insulin. Be careful not to mix long-acting insulin. Because if you mix long-acting insulin with any other type of insulin, then it defeats the purpose of the long-acting insulin. So for mixing the insulin, you have your NPH and your regular. The rule of thumb in it is clear before cloudy when you're mixing it in the syringe. So what we're going to do is we're going to take an alcohol prep. This is going to be my alcohol prep. And I'm going to make sure to clean the top of each using a circular motion. Then I'm going to take my insulin syringe and I'm going to carefully undo it. And for demonstration purposes, I'm going to say that I need 5 units of each. So what I'm going to do is I'm going to pull back 5 units of air and I'm going to inject it into the NPH insulin. So I'm going to take it and I'm going to inject it into the NPH insulin, being careful not to touch the needle to any of the solution. Carefully bring it out. And then we need 5 units of regular insulin as well. So I'm going to draw back 5 units of air and put it into the regular insulin. I'm going to inject that. Now, we're going to pull back 5 units of the regular insulin. Okay, got 5 units. And now, being careful not to inject any of the insulin into the NPH, I'm going to draw back 5 units of the NPH insulin, which should give me 10 units. And it's important to make sure to verify with another nurse. I would give them the insulin syringe and have them to tell me how many units they see. If we have the same number, then I know I've done it correctly. If not, then I need to discard of the syringe and redo it. So I've got the right amount of insulin. I would make sure to label my insulin syringe before I go into the patient's room so that I can make sure that I don't get anything mixed up. I would take it into the patient's room and I would put on clean gloves and do hand hygiene. Again, verify the information, verify the patient with their name and their date of birth, and verify that I have the correct type and amount of insulin with my MAR. Then I would go over to the patient. I would do an assessment. I would make sure that I don't go into the same administration site as what was previously given. There are 3 administration sites that you can use. You can use the abdomen, the back of the arm, and also the thigh. But usually we use the abdomen because it has the most subcutaneous tissue and it's easiest to get to. And so you want to rotate the sites as you go with each dose of insulin. So what I would do then is I would choose my site, and this is going to be the abdomen. I would take my cotton swab, my alcohol prep again, and I would clean the site using a circular motion moving outward. and I would let that air dry. And then what I would do is I would take my insulin syringe and I would go ahead and pinch up as much skin as I can. That way I can get the subcutaneous tissue. If I can pinch up about 1 inch, then I would need to inject in a 45-degree angle. If I can pinch up 2 inches, then I could do a 90-degree angle. So then I would take my syringe. Everything is clean, and I would pinch up the skin, and I would inject. I can pinch about 2 inches, so it's going to be 90 degrees. So then I would inject into the skin and slowly administer the insulin. Once I've got that, I'll let it sit for a second and then pull the syringe out straight and then apply an alcohol prep to the site. That is to make sure that we don't have any kind of infection, or to make sure that we have all the insulin injected and none of it leaks out. Once we do that, then I would safely dispose of my insulin needle into the sharps container. I would document the site. I would document where I did it, what the time was, the type of insulin, how the patient tolerated it, and make sure that I do thorough documentation. And then I would come back in a few minutes and just assess the patient to make sure that there are no signs of hypoglycemia. And so that's how you do insulin administration.